Welcome to the 55th Virtual Town Hall. I'm Command Sergeant Major Clark Charpentier alongside our Command Surgeon, Lieutenant Colonel Dr. Nadia Pearson.
Good afternoon, everyone.
And we're going to kick off the Town Hall as we normally like to by recognizing one of our stellar teammates. So with that, to DCOM.
Thank you, Sergeant Major. Today's awardee is Sergeant First Class Matthew Ursery, Senior Med Lab Capability Developer with the Fielded Force Integration Directorate. He was nominated for recognition for all of the time he dedicates preparing and teaching blocks of instruction for the MEDCoE's Soldier in Transition Training, or SIT program. His contribution to this essential training for future medical warfighters and basic soldier warrior tasks and drills reflects well on his unit and MEDCoE as a whole. He is being presented a Command Coin for Excellence for his efforts.
Outstanding job.
Thank you, Sir
Thanks for
Major.
what you do for our warriors, and thanks for being an outstanding non-commissioned officer.
Thank you, Sir Major.
All right, and if you want, you can address our audience.
Well, I like training, so I'll keep training as long as they allow me to. Thank you.
All right.
Awesome.
Outstanding job.
Congratulations.
Thank you.
Thanks.
Thank you, Sir Major.
All right, it's always great starting off these town halls on such a positive note, recognizing those that do great things. So once again, to all of our audience out there, thanks for joining us today. We do have quite a few pieces of important information that we want to share with you because it's been a little while since we've actually done one of these virtual town halls. I think the last one was on the 5th of November. So just in case you were not aware or didn't see all of the posts on social media, on the 10th of November, we welcomed Colonel Mark Weldy to the 32nd Medical Brigade, and he has already hit the ground running, and we expressed our thanks to Colonel Wes Anderson for a job well done after commanding the brigade for nearly 2 years. Also on the 10th of November, we took a very historic photo. We had over 4,000 soldiers and MEDCoE civilians out on the parade field. And you may have seen some of the photos that were posted out there. And we also got approval for and had drone footage to where we could actually see the breadth and depth of the size of what 4,000 soldiers actually looks like.
That's pretty awesome.
It most definitely was. And so we're putting the photo on our webpage. And for the Holiday Ball Committee, they're going to be printing out a copy as a keepsake for a fundraiser, so look out for that. Also, during this month, and actually it was this past Monday, we hosted the first ever medical career showcase in partnership with Mr. Joe Bray, who is the CASA, Civilian Aide to the Secretary of the Army for South Texas, and alongside the 5th Recruiting Brigade and Battalion, because we wanted to reach out to over 200 future soldiers, potential soldiers, and to share with them the opportunities that Army medicine has for them and the opportunities for training and for future careers. So I just, if you missed it, check out the photos on social media, and it was also a recording of it, so if you want to hear the great information. So, other events that are fast approaching. Tonight, one night only, the Holiday Ball. It is going to be happening tonight, and that's going to be a great opportunity. And on the horizon, we have Holiday Block Leave, which I know is a subject that you're going to want to hear about and probably have some questions about, and we'll do our best to answer those questions for you. So first of all, I just want to give a shout out to the 187th Medical Battalion leadership and team for all of the hard work that they led, the volunteers, the committee, and everyone else that was involved in planning the Holiday Ball. Because let me let you know that behind the scenes there was a lot of things that were going on, because there were lots of challenges, changes, and there were even some times that we didn't even know if we were going to actually be able to hold the ball based off of Force Health Protection guidance and then also directives from higher Army leadership. But the team has been super flexible, rolled with the punches, and in the end, they have planned an outstanding, safe, and fantastic event. And I can tell you that from my perspective, my wife and I are extremely excited to participate tonight and be able to celebrate many of our victories. So this is our second attempt at doing our centennial theme ball, because 2020 was our actual 100-year anniversary, but unfortunately we had that, once in 100 years pandemic thing happening, so we had to put that on pause. But we're going to celebrate this year, and we're going to do it in accordance with headquarters DA guidance and ensure that that all personnel are vaccinated that are attending and masked for attendees. So we'd rather be able to celebrate a year later, and also we'd rather be able to celebrate with everyone, but this is the next best thing that we can do, and just look forward to having a little bit of time to let down our hair and party a little bit.
Yes.
To you, Doc.
Thank you. It's great to be here. I feel like it's been a very long time since I've been able to attend and put out some guidance and information. And to the Holiday Ball Committee, thank you for being so resilient. There has been a lot of force health protection guidance and guidance from our leadership and the Army. And there are some disappointed teammates tonight about the new guidance that was put out. But we are being resilient, and we will hold the ball, and it is in due time, since we had to reschedule it, postpone it from last year. So just remember that, it was for a readiness issue, vaccinated members there, and we will be wearing masks and doing all the things to protect the health and welfare of our community. And so I just wanted to remind everybody, the reasons behind all of that is because there are some people that won't be celebrating the holidays this year, and there are some of our teammates, some of their family members that have gone through some significant hardships during the last 2 years of the pandemic, and we are still losing over 1,000 people a day from COVID. So although it may not be in your sphere of reaching the immediate families, somebody has lost somebody from this illness. So it's really important that we remember that, and our colleagues up in the north, they're dealing with some significant COVID issues right now, and there's some concerns about the Omicron variant. If you get a chance, there has been published a video from BAMC, from our infectious disease colleagues, on the Omicron variant, so I encourage you to watch that video. It has some really great information in there about vaccines and new variants and such. So I encourage you to do that and stay informed. We're approaching the 800,000 mark for deaths from this illness. So this has not been insignificant, and that has far exceeded our predictions for this illness. So thanks for what you're doing. Thank you for continuing to watch our force health protection guidance. It comes from our Army public health community, as well as higher up force protection, and combined with CDC and public health guidance in general. So we're all pretty over this. I know, COVID for me, coronavirus was a normal thing for the other coronaviruses before this particular COVID-19 variant. But we are all, having COVID fatigue. So stay resilient, stay informed, and we're gonna continue to get through this.
Yeah, thanks, Doc. Do appreciate it, and those are things that a lot of us, as we go about our daily lives. At this point, for some of us, it's become the norm. It's become an accepted part of what we do. But as you mentioned, for others, it's definitely hit home a lot harder.
Yeah, so anticipate changes, as we go. Again, resiliency is the term. If we have to remask again, we will do so. I highly encourage boosters at this point, 6 months after the initial series of Moderna or Pfizer, or 2 months after the Johnson & Johnson vaccine. So protect yourself, protect your family members, especially with holiday block leave coming up, family members at risk.
Yeah. So holiday block leave, you mentioned that, and I know that that's the topic that's on a lot of people's minds. So we're going to dedicate probably a lot of the time of this virtual town hall to that. So bottom line up front, yes, we are allowing trainees to depart Joint Base San Antonio, Fort Sam, Houston. And so beginning next week, the majority of our students will be departing next weekend, 18th, 19th, and so on. And majority of them are returning between the 2nd and 3rd of January after the new year. So we have allowed, enabled, and encouraged holiday block leave travel, because our soldiers leaders, civilians proved last year that they know how to do it and are disciplined enough to keep themselves and their families safe from COVID-19. So, especially with the vast majority of our trainees fully vaccinated this year, it was a much easier decision to come to
Yes.
to support that part of people first and soldiers having that opportunity. So additionally, our leaders and drill sergeants have done a phenomenal job of planning and preparing for this annual event, conducting rehearsals and a lot of coordination to ensure everything goes smoothly. And I just want to say the rock drill, the rehearsal of concept of operations that the 32nd Medical Brigade put on, outstanding opportunity to see exactly how all the moving parts are going to go. So your soldier should have already worked out their plans and with their leadership for travel and know the requirements. But if there are parents or family members that have questions, please check out our holiday block leave webpage. And I think DCOM is going to put that in the comments. So I think you will find that the frequently asked questions section to be helpful. But stay tuned, because as we get into these important holiday block leave updates, they may be posted. So anything else to add on that, Doc?
Yeah, so make sure as you're planning your leaves, plan accordingly. A lot of our soldiers, employees, trainees, they have more information than the families do. So spread the wealth of information that we have, that we've given, previous recordings that we have done. I encourage our soldiers to make sure that their planning is very sound. As we encourage everybody to take holiday block leave, this is a time for everybody to recharge. Please make sure that you are disconnecting from your electronics and taking a moment to just enjoy people around you, family members, or whatever floats your boat. Whatever makes you recharge your own batteries is what you should be doing over the holidays. And also remember that the holidays are not always a happy time for everybody, so keep your friends and colleagues, family members very close and on speed dial for there. We are also an Army family, so we also have some soldiers that are going to be staying back here with our family here. And just know that we have some great activities and things that are planned to keep them connected, have fun things to do that are safe, and make sure that they're safeguarded and healthy here as well. And so with all of these things, whether you're going to be home on leave or you're going to be here with us through the holiday block leave, we encourage you to continue monitoring for signs and symptoms of illness. This is also flu season, and we've seen an uptick of influenza in the communities and other viruses. Lots of other viruses cause common cold or flu-like symptoms. So monitor yourself. And make sure that you're going to get tested if you need it. Vaccines don't necessarily stop you from getting COVID, but they protect you certainly from hospitalizations or death, any bad things associated with that. The last thing that I wanted to leave you with is do not forget that there are other things that we need to be doing as far as force health protection. When you are traveling, there is a requirement to wear your mask. So please remember surfaces that are highly touched may be contaminated, so try and avoid those things. Wash your hands frequently if you're using public restrooms, and maintain your mask, especially when you're in public areas of transport. Other areas are not as privy to the low community transmission rates that we have here, and so other areas more transmissible. We will be testing unvaccinated soldiers who are either pending exceptions to policy or for whatever reason have medical issues and are unvaccinated. We will be testing them. There is a requirement, recall, for all civilians who are unvaccinated to have weekly tests that started back in November, and also soldiers will have a weekly test as well. So it's kind of part of all of that, but again, to safeguard them, unvaccinated soldiers will be tested. And they will also resume testing when they come back from holiday block leave. We will also be testing symptomatic folks who come back from holiday block leave. So if you have a little sniffle, a fever, whatever it might be, we encourage you not to travel and get a test before you travel. But if you do return, like symptoms developed en route, you will be getting a test. And then anybody who is screened positive, so we will be doing 100% screening of everybody that returns. And any of those folks will also be able to see a provider and receive testing as well. So a well-orchestrated holiday block leave return. I am super proud of my team, and also, thanks to 32nd Med Brigade, HSC, and COA for assisting with all of the planning and, continuing to make our area safe for the holidays. So with that, Sergeant Major, did you have anything else before we went
So
to
just
MEDCoE?
one comment to add on to that. So, throughout this block leave period for the families of our soldiers, help them to continue to do the right thing, help them to continue to be safe. I ask each one of you as, you value your family member, we value your soldier and your family member, and, please just ask for your support to help them stay safe throughout this process. And if there are changes in their health while they are on holiday block leave, then encourage them to reach out to their chain of command and let them know, so that way we are better prepared upon their return. If they're feeling ill, it's not that we're going to pull them back early or anything like that, but just so we're prepared to take care of them when they return to us.
Yes.
That would be a
And
great thing.
tests are free. So you can go to a place, a drive-in, urgent care, and get a test. So it's not uncommon. You can also purchase them. They're fairly inexpensive. Those are the home kits. There's a little difference between some of the medical tests and the home kits. But at least, make sure that you're getting yourself tested and care if you need to have medical care also.
Yep. All right. Well, I guess with that, we can turn it over for questions.
Thank you both. Lots of great information. Sergeant Major, the first question is for you. What is the alcohol and tobacco policy during holiday block leave?
All right, great question, and that's something that everyone is always attuned to and really want to know, because even though our soldiers are on leave, they are still in a training status. So there's regulatory guidance which governs the things that they can and cannot do. But first, I will say that from a federal law perspective, it is illegal to consume alcohol if you are under 21 years of age. That's the bottom line. It's illegal. And our soldiers are far too smart, too fit, and too disciplined to do that. So I know that should not be a problem, because our soldiers are professionals 24/7. So I would say that additionally, for the parents, friends, and others that may not know, so our soldiers during holiday block leave travel periods, when they're traveling to and from Joint Base San Antonio in whatever conveyance that they're in, whether it's a plane, train, automobile, or whatever other method, alcohol and tobacco use is prohibited for soldiers during that transition to and from holiday block leave. So for our soldiers out there, make sure that you turn down that cocktail from the flight attendant. Make sure you're not stepping into the smoking lounge at the airport. Plus, it's just to remain healthy. As I said, smart, fit, and disciplined. So getting through that. So also, soldiers must refrain from using any illegal substances, to include non-prescribed medications and marijuana. So as a reminder, and this is not a secret, all soldiers are going to undergo a drug screening test upon return. And so it will happen. So once again, encourage your soldiers to remain professional, and ask you not to put them into predicaments where they are forced to make some difficult decisions and potentially are influenced by family members. So bottom line, it's imperative that you present yourself well disciplined. And this is a message for the soldiers. Remember, you're a soldier 24/7. Be professional at all times, and just make sure that you're ready to return to training and you uphold the Army values.
Thank you so much, Sergeant Major. Ma'am, the next ones for you are definitely number one health-related question. If soldiers get COVID while on holiday block leave, what do they do?
So it's absolutely possible that you'll get COVID on holiday block leave or at any time. So remember, the vaccine will protect you from serious illness or death, but it may not protect you from actually getting a very mild case of the illness, which is fine. It is not punitive, and I want to reiterate that point. It is not punitive if you get COVID. I mean, it's possible. Everybody, goes to public places sometimes. There's going to be celebrations and different exposures. The thing is, if you do get exposed, or if you do have symptoms, that you do the right thing and you tell your chain of command, keep us informed as to what is going on, and get tested. Also, if you need medical care while you're at home, there's always 911 and urgent cares. Everybody who is a soldier is covered under TRICARE of some various type. If you're having a breathing emergency, please get it checked out sooner rather than later, because there are medications now that you can be given to shorten the course or make the course of your illness less severe. So inform your chain of command. That is something that we really need you to do. As far as your leave goes, there are different parameters that we can change your leave status to a con leave or a sick leave. So don't worry about that. The chains of command will help walk through the process if you do get ill at home. We do not want you traveling ill with COVID and spreading the illness. So if you do get ill at home, it's still a 10-day isolation time, just like if you got ill when you're here or anywhere else in the country. And then once you recover, you will return to Fort Sam the same way. And again, we'll work with your programs and different things. You have a holiday safety card that you will be issued, all the soldiers, before they go. It has all of this information on there. We are posting everything on our website as well, so as far as holiday block leave guidance and information. So I encourage you to look on the holiday block leave webpage for the most up-to-date information, or questions and concerns can be submitted there as well.
Yeah, so really the add-on to that would be, for the family members, if your soldiers get sick while they're here, encourage them to contact us, contact their leadership, once again, to keep their leadership informed so that they know if there are situations that require them to delay travel or how that's going to impact. So just encourage everyone, be honest and transparent in reporting when you don't feel well.
Absolutely.
Thank you both. So, Major, the next one's for you. This comes up every year. So can soldiers who have long trips, per se, change clothes at the airport on their layovers before they reach their final destination?
Absolutely great question, and I will tell you that the guidance is soldiers must remain in uniform and masked while traveling to and from holiday block leave and in their modes of transportation. And it is a federal mandate right now for anyone that's in airports or public transportation terminals that they do have to remain masked. As far as wearing the uniform, to our soldiers out there, be proud that you are an American soldier. Wear your uniform proudly. Display the professionalism that you have. And I will tell you that, even though you think that if you get out of uniform that people won't recognize you're a soldier, people still recognize that you're a soldier. And there's an expectation from our American public of how you conduct yourself and how you portray the professionalism that we're so proud to be a part of. So I know it's tempting to go in the bathroom and change out, at the airport, on that layover. But remember, it's not just here in San Antonio at the MEDCoE that we have leader presence at the airport. It's every airport across the nation. We have soldiers throughout the Army that are going on holiday block leave, and there's going to be leaders everywhere, and they're going to see what you're doing. So just make sure that you maintain the Army values, particularly integrity and doing the right thing even when nobody's watching. And as you go through your travels, you will find that the pride, the joy, and the admiration of the American public as you walk through that airport, the bus terminal, the train terminal, proudly wearing your uniform and representing not just yourself, but our entire Army.
Yeah, when they say thank you for your service, that is one of the things that makes me most proud. And my comment back to them is always proud to serve.
Yes, and proud to serve, or it's an honor to serve.
An honor to
Or a
serve.
privilege to serve, yes.
Great point. Thank you so much. Okay, ma'am, the last one is for you. So where do family members pick up their soldiers if they're traveling via privately owned vehicle to holiday block leave?
So there's some OPSEC concerns about giving the specific location, but your soldiers should already be aware of where that location should be. So I encourage you to discuss with your family member, with your soldier that you'll be picking up. As far as the pickup procedures, they will be in the company area somewhere, but the procedures are the same. If you're coming on the installation, DoD ID card holders with base access come on just as normal, and you show your ID card at the gate. If you're a non-DoD ID card holder coming to pick up your soldier, you stop at the visitor center. So it's a location just outside all of the access points, and you'll get a pass. You'll need your driver's license and I believe your insurance registration information for your vehicle, and they will issue you a pass to be able to get you to pick up your soldier in that area. So bottom line is, the soldiers are aware of the procedures and where to meet you specifically, but that should be an offline discussion with your soldier.
Yeah, the other thing is just bring your patients with you,
Yes.
because there may be some extended wait time, so just encourage you to bring patients, listen to some holiday music or whatever it is, and be festive and jovial and look forward to that reuniting time with your soldier.
Yes, so thousands of soldiers traveling all on the same day. Yes, you can anticipate some longer lines.
Thank you so much. And in the interest of time, we'll turn it over for closing remarks.
Sure, and of course, to our command surgeon for the words of wisdom. Ma'am.
Yeah, so as you go home, I'm very excited, about holiday block leave. I hope you, again, use this time to recharge your batteries and ensure that you are using the tools that we have given you, the information, the right information, to help celebrate these times safely. So mask wear still encouraged at large events, especially since we have areas that will be commingling and different pools of people with, possible carrying different variants. It will be easily to spread different kinds of viruses and germs. If you can, get outside. Enjoy the fresh air, move the venues. If you're sitting inside with a lot of people and it's nice outside, encourage them to move outdoors to the backyard. I will say one last plug, please go get the shot. Get your boosters if you are eligible at this time. It's super easy. Most of the facilities, even if you don't get it on post at our clinics now, you can go to any local pharmacy, Walgreens, CVS, HEB, or whatever your local grocery store and get it. Encourage your family members to get the shots and their boosters. Tell them the right information. Vaccines as far as influenza. It is required 100% vaccination for our soldiers before they go on holiday block leave. So we will also have our soldiers encourage family members to be protecting themselves from influenza as well, because in turn, the more people that are vaccinated that our soldiers interact with, the safer it is for our soldiers as well to continue training. Again, frequently asked questions, refer to our webpage that will have the most up-to-date information on there, especially those COVID holiday safety cards that are on there. Also reference the video from our local military hospital, BAMC. They posted that video on the Omicron variant, which is excellent. It's our local infectious disease doctors there. As far as other issues with behavioral health, again, know that this is not a happy time for everybody, and sometimes when we return to our families, it is not exactly how we remember it or how we left it. So sometimes there is some extra conflict or different things that we think about that may not necessarily agree, like disagreements. If you have those kinds of issues, there's behavioral health contact information 24/7. You can always talk to a counselor, a provider, via Military One Source, and that information is on the contact cards. It's on the internet. You can Google it. Crisis line, the Veterans Crisis Line as well, 1-800-273-TALK, and is the nation's suicide prevention line. So the worst thing that could happen is if we lose a family member, meaning one of our soldiers, one of our employees over the holidays. So please keep that in mind. keep our people close. The JBSA We Care app has all sorts of information on there. Download that, use that information as needed, and share it with family, friends, and colleagues. Finally, just enjoy a happy, safe, healthy holiday block leave, and we look forward to seeing you on the return.
All right, thank you, Doc. Absolute great points, and really focusing on our people being our most important resource. So, some of you watching may be aware of or may remember that this calendar year on January 1st, the early hours of it, we actually lost one of our team members. Drill Sergeant Jessica Mitchell was a victim of gun violence last year, and her killers have not been found at this point. However, the CG and I do have regular meetings with the San Antonio Police Department and the lead detective working the case. And we thank the SAPD for all of the hard work that they continue to do in pursuing every lead and trying to get to justice for our fallen family member, Drill Sergeant Mitchell, and her family. We will not give up. We will not forget, because she is a soldier for life and is one of our team members. So I know that with the holidays approaching, that those that work closely with Drill Sergeant Mitchell, this will impact even more. So to those members of our team that are going through that, I just encourage you to reach out to someone to get help, to get assistance, so that way you can work through this and we can get through this together. And not only for that reason, for other reasons, the holidays are not always a happy time for everyone. So if you are having that particularly hard time, don't suffer in silence, don't suffer alone. Reach out. Chances are your battle buddy may be feeling the same way, or at least will understand the challenges that you're going through. Connect to protect. It's a good thing to remember our soldiers departing, and they're departing the relative safety of our training environment. And as they go back to home, they go back into situations that, that they're away from their battle buddies. Remember, they still have connection of families and friends. So I just would encourage everyone to remember, your soldier coming back home may be a little bit different than the soldier that left for training a few months ago. This is someone that maybe has grown, matured, or has otherwise changed a little bit. So the acceptance and understanding that we as soldiers, when we go back to where we started or where we were before training, we think that everything at home has changed, but it's not everything at home that's changed, it's us that has changed. So it's just something that we all need to remember and enjoy the time with them. So, the CG and I, we will have a list, as we have at previous holiday seasons, a list of our soldiers with phone numbers, because our intent is over the break, we're going to reach out and call them. And really, it's just about connecting with them, and we are encouraging leaders at all levels to do the same. 5 soldiers, just call them at some point during holiday block leave, check in on them, wish them happy holidays, see how they're doing. So, my challenge to everyone, whether you're in an official leadership position or not, is reach out to somebody over the holidays. Somebody maybe you haven't connected with in a while, somebody that you work with, and just check in on them. And I tell you, that will go a long way, and we'll be able to connect with the majority in our footprint. So thanks again to each one of you for continuing to tune in for these virtual town halls. Stay focused on taking care of our soldiers, our family members, our civilians, and everyone else that's involved in the training of the next generation of professionals that are going to take care of the warriors on the battlefield. So a special thanks to all extended family members that are out there supporting our soldiers and our civilians, because without you, we could not do what we need to do every day. So my personal wishes, along with the sentiments of the CG, is that each one of you have a stellar holiday season, get some time to reconnect, to relax, to enjoy family, to enjoy friends, to enjoy the hobbies that you most hold on to as being part of who you are. And that way you can be ready to continue the mission set next calendar year. So our next virtual town hall is scheduled for the 7th of January, just after we return from holiday block leave, and I look forward to it being a great time. So be sure to tune in, and I look forward to seeing many of you through the holidays. And once again, I'm proud of each and every one of you, what you do, and I thank you for supporting our soldiers and civilians. Army medicine starts here.